I think one of the biggest misconceptions is they don't realize the services that are provided here. These are patients to us, they're not just inmates, and there's a real opportunity here to provide them with services that they wouldn't have access to in the community, and those are the services that are often neglected and they're not compliant with. So for some of these patients, it's the first time that they've really had mental health care. They've had access to medications, they've had access to therapy, and to seeing doctors that they normally wouldn't see in the community. So in addition to being incarcerated while they're waiting to pursue their legal issues, we're working every single day addressing all these medical and mental health issues and a progressive plan, a care plan to help them move forward and take control of their own health care.
I think that probably one of the biggest misconceptions in the community about mental health in the corrections facility is that it is somehow the will of the patient to act out, that it's an intentional behavior. And oftentimes, or in most cases, that's not the case. The patient is acting in a way that they lack control over, and we need to help them to behave differently in a way that's more socially appropriate. But I think one of the big challenges is that folks see that as something that a patient has the ability to control themselves.
I think the biggest misconception is that the Mecklenburg County Sheriff's Office, Correct Care Solutions, is not focused on providing quality care to the patients that come to this facility. It is our passion to provide quality care, to keep patients safe, and quite frankly, improve their health care status to a point where they're better off when they leave than when they came. Are we perfect? No. But our focus is on to identify people early on and to improve their health status and not to deny. The biggest misconception is that the staff at any facility are looking to deny care when really we're looking to promote health care.
Being the sheriff, looking at, we got to make sure that I have a very, very strong health care partner. Did not realize until I became the sheriff that actually our facility is the largest mental health holding facility in the county. And we want to make sure that these folks are cared for when they're in our facility and in our custody.
I invite anybody who's skeptical about it to really dig in and learn a few stories about a few people who have behavioral health disorders who are in the jail and the justice system. Because usually if it is, if you really look into it, it's not as simple as this is a bad person and they did something and they need to be held accountable. There's usually much more to it, and often there's a lot of misfortune there, and if people were well, then those situations wouldn't occur.
The mental health demands have always been consistent throughout corrections. We do receive a numerous amount of patients that have critical mental health issues that have gone unaddressed. Oftentimes we're seeing these patients as being homeless and not having access to health care. This has increased significantly over the last couple of years, and the severity of the mental illness has been trending upward as well.
With the fact that 96% of all inmates will be released at some point, the question for us as an agency is, how do we want them to get out? The inmates, when they come in for various problems. Mental health, substance abuse, homelessness, no vocational skills, etc. So for us, if we want to make sure that they do not cycle back through the system, we want to make sure that we address those issues once they come into custody.
When I first started law enforcement, we never had any of the technology, the facilities, the treatment that we have today. We started a strategic business plan that we are carrying out now, that every one of our detention officers is going to be trained in mental health first aid. So they're able to recognize if these inmates are in a mental health crisis, and they're able to respond to it to make sure we're maintaining a safe and secure facility. And then also they can assist with these folks that are recognized if they're having mental health issues, that we can work with our provider.
There are a variety of challenges in the correctional environment in managing mental illness. One, of course, is the patient's interest in that treatment and their willingness to participate in the care. In the correctional environment, they may have other priorities. They may be more focused on their case, or they may be more focused on just adapting to this environment. And so their own care of their mental illness may not be their number one priority. And engaging the patient in their care, getting them on board and to partner with us on their care can be the first obstacle that we have to overcome.
We've been fortunate to have multiple sheriffs that have made sure that this is something that remains a priority for the sheriff's office. Sheriff Carmichael has been no different. He makes sure that we have funding. He makes sure that the staff, detention staff, is aware of this need and prioritizes it on a daily basis.
As medical director, it's my responsibility to provide the clinical oversight of all the medical operations here at the jail. So any necessary new programming, I would be involved in program creation and implementation, and just make sure that day to day the clinical operations run smoothly, that good care is provided, and on a more global scale, that we have plans for process improvement so that we're always getting better.
So the Sheriff's Office does collaborate with us on a daily basis regarding our mental health patients. They have several programs that are very beneficial to assist us in getting to a therapeutic level of health care for these patients. Vocational programs, Jail North has juvenile programs, group programs, horticulture programs, various activities that the patients can engage in as they prepare for discharge in managing their illness moving forward.
CIT is a model that was created in Memphis in the late 80s that's about making sure that law enforcement respond as well as they can to people when they encounter someone who's having a behavioral health crisis. And the primary goals are to, number one, when it's safe and appropriate, divert from jail to treatment. And number two, make sure nobody gets hurt, that the professionals don't get hurt, and of course the people that they're responding to get help rather than there being any harm caused.
We've seen an increasing amount of use of CIT officers. We're trying to capture the outcomes. We're hearing more and more stories of positive outcomes. I've actually seen a couple of them in person. I think it's just basically going to make life safer for officers. It makes life safer for people who have illnesses, whatever disability it is, addictions. So I think it's a win-win.
One of the really important components is that there are people involved with CIT, both professionals and volunteers, who are both people who have their own lived experience with mental illness as well as their family members. So there is an intentional addressing of stigma. CIT really addresses the issue of stigma.
You know, when I first came in, CCS was already in place. And I met the team, and I met the upper management. And I have to say, in the 3 years since I've been sheriff, anything that's ever been questioned or there's an issue, once we addressed it with the first level management, it's immediately addressed and it's handled. And that's what makes a strong working relationship. And then CCS is innovative. They're always thinking outside the box. What's a better way to care and care for their customers and their clients?
I think one of the ways that we've partnered with the Sheriff's Department in improving the delivery of mental health services is in the way we communicate with the custody staff. They help serve as our eyes and ears as patients are deteriorating or improving, frankly. And so although they're not intimately involved in the delivery of healthcare services, they can help alert us to problems that we may not otherwise witness, and we're able to act on those a lot quicker.
The Mecklenburg County Sheriff's Office has an extremely focused and robust mental health program to include timely identification at intake, referral for full evaluation by licensed mental health professionals, access to medications by psychiatrists, discharge planning, suicide prevention, focused treatment for patients with a substance abuse to include withdrawal. The sheriff recently has added mental health professionals dedicated to the juvenile population. This total program can match itself to any program across the country in any jail.